about strength. I want to speak about building strength. We're not just throwing around cute phrases. We really, really believe this. We really believe this is the way to go, right down to our very bones, as they say. I personally don't believe in prevention that much, because prevention connotes defensive stance, and we know that, well, for one, you don't win wars by being in a defensive position. Actually, you don't win games or anything by being in a defensive position. You win by being strong. You win by going for the goal and for the target, and summoning up, marshaling your powers, your mental, your physical powers to that goal. And I think this short time we have on this earth, we need to make the most of it. And the only way you build strength, really, the starting place has to be knowledge. And that's why I love this verse here, that it says, a man or woman of knowledge increases strength. And so that's where we need to start from. And if for those of you who were with us at the very beginning, these were the three things that we kept on putting up on the screen when we started our webinars. We said we've got to be familiar with these three. You don't. It doesn't matter if you're a health nut or a lay person. You've got to be familiar with these factors. And of course, number one there is how our bodies work. Number two, what our bodies need to function. And that, of course, includes good nutrition and several other things. Now, look at this down here, threats to our health. Unfortunately, so many people are very, very unaware of that other aspect, because, of course, very few people talk about it. And we've done a careful job of putting together speakers and presentations that focus on these 5 factors: the chemical toxins, heavy metal toxins, of course, mercury in our teeth, especially with those of you who have amalgam fillings. Biological agents, this is more a factor in places like where I'm from, like malaria is the #1 killer around the world. But of course, some of these, the flu virus, again, is a big thing around here. And of course, radiation. And really, we're still trying to get someone on to come and speak on the dangers of electromagnetic radiation, including that from those from cell phones, from microwaves, and all those other things. So if any of you out there know of a reputable company or a reputable person who has good credentials behind them and can speak intelligently about this area, please let us know. Okay? But the truth is, folks, in spite of knowing about all these things, I want to say there's one thing above all others, above all these, dare say, combined, that is much worse, a much greater threat to our health, and that is ignorance. That is ignorance. And this goes well along with what the World Health Organization says. The 2 obstacles to vibrant health and longevity are, number 1, ignorance and complacency. It has not changed. And that's why we do what we do. And that's why we are extremely also blessed and privileged to have someone like Dr. Dolan come speak to us. Because there are 2 types of ignorance. Sometimes it's inadequate information. Number 2, I think, is what we in the Western world are foremost prey to, is misleading information. There's a lot of information out there that simply isn't true. And again, that's why we're so glad to have Dr. Dolan come help set the record straight for us. So, Sherry, I'm going to ask you to go ahead and introduce our guest while I transfer control to her.
Okay. Moira Dolan, MD, is a board-certified internal medicine physician and the executive director of Medical Accountability Network, which is an educational resource dedicated to establishing integrity in medicine. Dr. Dolan addresses the responsibility of participants in all aspects of the professional and public communities affected by medical issues. Dr. Dolan is also serving as medical consultant for the state of Texas and the Office of Texas Inspector General. She is editor of the subscription website SmartMedInfo, which defines a new role that patients in helping patients take that new role in their own healthcare decisions. Dr. Dolan's presentations are in lay language with real-life examples that really do communicate well to everyone. So again, we are incredibly grateful to have her here tonight. So Dr. Dolan, are you there? Oh, I gotta unmute her.
Thank
There,
you, Sherry.
Dr. Dolan, are you there?
I'm here. Thank you so much for asking me to come on again. I'm real excited to give this presentation today because I think it's extremely timely to talk about bad ideas in medicine because they're rampant right now. We could actually fill several webinars worth, but I just picked a few select things that I'm real interested in regarding bad ideas in medicine, but this could actually be a whole series if you're interested.
That could be interesting.
Mm-hmm. Yeah.
So I'm just going to touch on some of my favorite bad ideas in medicine, and I subtitled it, "We're Just Practicing." One thing that you learn in medicine is there's a little bit of science and a lot of trial and error, and the rest is simply buffoonery. I mean, and it's okay if the doctor actually admits that, but when they don't admit the limit of what their science is, that's when it gets to be pretty dangerous. And as Sherry said, I am with the Medical Accountability Network, and we have a medical information site called smartmedinfo.com, where you can find out what your doctor isn't telling you or more likely just doesn't know. So let's jump into some bad ideas in medicine here. Leeches is always a good place to start. These are blood-sucking worms, and they've been used as a medical treatment since at least 1500 BC in Egypt. Now, for something to hang around so long, it must have some benefit. Let's take a look, though, at the word origin of leeches. It's kind of interesting. It's Old English for physician actually comes from the Celtic word meaning charmer, exorcist, or physician. And I want you to keep this in mind when we talk about some of the modern-day bad ideas in medicine of a physician as an exorcist. Same word in the Gaelic language. Very interesting, I found that to be. So leeches are actually blood-sucking worms, and this is just a close-up anatomical drawing of what would be their mouth. And they also have substances that they secrete that keep the blood from clotting, and also some substances that are, believe it or not, they look like they're antiseptic. And so again, there is some truth to how they may have worked. They're freshwater flatworms. They've been used in Arabia, India, Africa, Europe, and the Americas for everything from acne to fever to congestive heart failure, even excess gas or war wounds. In fact, old medical textbooks list leeches as a remedy for cancer, for epilepsy, for pneumonia. But you've got to wonder if sometimes the remedy is not worse than the disease. What we find is that the population of Europe increased by 110 million during the famous leech shortage. So, maybe that's why they were allowed to flourish, because people weren't being bled to death anymore.
Oh, my goodness.
Now, there is a famous leech victim, and that is our own first president, George Washington. He had symptoms of a cold, and he was bled to death after losing what was at that time said to be 4 pounds of blood. So this is many, many units to come up to 4 pounds. And his doctor was actually Dr. Benjamin Rush.
One of the scientists.
He was a faculty member at the University of Pennsylvania, which was a hospital and medical school. And in fact, it was the first all-American medical school in the United States. And there is actually a medical college named after him now, the Rush Medical College up in Chicago. So he's remembered as a co-signer of the Declaration of Independence representing Pennsylvania, but he was also the chairman of the Department of Medicine at the time when he was Washington's doctor. And at the time that he was on the staff of that hospital, it was considered one of the best hospitals in the country. And yet he was delivering this deadly therapy to our president. But if you take a look at Dr. Rush, he was also called the father of American psychiatry. And this is an example of another one of his choice treatments. This is called the tranquilizing chair. And you can find out more about this on the website of the University of Pennsylvania Medical School History section. and people would actually be tied up in this chair. Now, he also had a dunking chair where he would have this elaborate crane-like device that would dunk people into a cold pond, but this was the tranquilizing chair. So this is one of his more bizarre remedies. People would be actually in this chair and be lowered into a cold lake until near drowning. Now, in both ideas, leeches and the tranquilizing chair, the idea was to purge the demons. The demons, of course, being responsible for the illness. Now, leeching was actually the standard of care back in that day. For everything from fever and pneumonia, infections and colds to, like I said, cancer, but also heart failure, coma, war wounds, quote, bad blood. This is where they, what today we would call viruses, they call it bad blood, demons, excess gas, acne, but also bleeding conditions, nosebleeds, menstrual bleeding. So you could see that there was not a lot of science behind this. So maybe in some of the cases it was more effective than shaking a witch's rattle, but maybe not. For instance, heart failure we know today is a condition of too much fluid because of a poorly pumping heart, and today we give diuretics. Well, what they were doing was basically letting off blood so that the heart didn't have that much volume to pump around, and those people probably did get better. In the war wounds, there probably were cleaning up any dead tissue or sources of infection right there, and leaving a little bit of antiseptic behind from the substance that is in the leech's mouth. But for the rest of this, who knows what they thought they were doing with it. Now there is, like I said, a kernel of truth. This is actually a contemporary picture of a traveler in India who had a leech get on him when he was traveling through the jungle of India. And this is a half hour after the leech was removed, and you could see that it's still weeping blood. And that's because it does have a little bit of an anticoagulant, something that keeps the blood from clotting. It stays on the surface of the skin for at least half hour after the worm is removed. But they also have substances in their saliva that decreases pain and inflammation. So again, maybe it was beneficial for some of these things, but bleeding people to death is not a really good idea. Now, maybe some people do have too much blood or too much iron. We know that too much iron increases the risk of a heart attack. It's interesting that menstruating women have a 50% less risk of heart attack compared to men. Men who regularly donate blood have a 30% lower risk of heart attack compared to men who don't donate. So, we know that many bacteria also, like Staph aureus, for instance, it feeds on iron. So maybe there was some beneficial effect there of leeches in some people. Now, the modern use of leeches is really confined mostly to cosmetic surgery and taking the swelling out of skin grafts. It's being experimented with to treat frostbite and also to treat blood clots in the legs. What they're really trying to do is extract from the leech the active ingredients and reproduce that in the lab. But right now, I think we could see on the celebrity magazines that Demi Moore has been using leeches for the equivalent of cosmetic surgery on her face. Excuse me.
She has been using the actual leeches on them on her face?
Yeah, it was on People magazine a couple weeks ago.
Okay.
Now, so we'll move on to, now leeches are about the best thing I'm going to talk about today, so you can get an idea where this is going. We'll move on to another crazy treatment. This was Radithor, which was basically radium, which is radioactive, and it was offered to treat everything from impotence to high blood pressure to anemia, arthritis, indigestion, and to harmonize the blood. Well, what we saw around the turn of the century when this was marketed was some people were getting what we know today to be leukemia, and they would give this for, quote, blood harmony, and they would actually improve. And what they were doing is they were, unbeknownst to them, treating with radiation, a common treatment that we use today, using this Radithor. Now, how it worked on impotence and indigestion, I don't know. But what happened is people started dying of cancer who were using this, and this was pulled off the market. Now here's another crazy treatment, and this one I'm kind of getting out of order on the time here, but that's because I'm going to go into various shocking types of treatment, and this is the earliest in that history. This is a plant that's also called the Christmas flower. It's also known as hellebore, and it's from the Greek words food that injures. Okay, in other words, this is a poison, and this was used since the ancient African physician Melampus, supposedly in 1400 BC, but it was popularized by the Greeks. And it was especially used to treat mania and other mental disorders. It caused vomiting, diarrhea, and seizures. And seizures is what they were really going for in this. The idea was, again, to exorcise the demons and to get the badness out of the person. Unfortunately, it was often accompanied by the death of the patient. Now, by the 1600s, hellebore was actually still being advocated even by such noted physicians as Parkinson. You may be familiar with a disease named after him, Parkinson's disease. And he was a prominent neurologist, or what we would call today a neurologist, in the 1600s. But he said really it should only be used for deranged animals and really had no use in humans. Doctors have not given up on this idea of shocking the demons out of someone. From the time insulin was discovered in the 30s, straight through the 60s, insulin coma was actually used as a treatment for mental disorders. And this is where they would actually inject enough insulin to bring the brain blood sugars so dangerously low that a person would go into coma, and they would keep them there, sometimes for days at a time. And this, as we know from diabetes, kills brain cells. When the brain does not have enough food, that's glucose, because it's not being allowed to have it because of the insulin drives the glucose so low that once it's gotten into the cells, there is no more. It's actually a brain-damaging treatment. Now, in modern times, we have something that's become popular just in the past couple years called ketamine coma. Ketamine is a man-made chemical that's used as an anesthetic for surgery. It's in a class of drugs called psychomimetic, and this is a word that means that it causes the exact symptoms of the worst mental derangement of all, and that is psychosis with hallucinations. Even a one-time ketamine dose can cause clear schizophrenia-like symptoms. It can make a normal person actually become permanently schizophrenic, and that's why some people have really bad reactions to certain anesthetic agents. So a ketamine coma is actually being sold as something that's going to treat chronic pain. It is an anesthetic, but what they do is they actually bring the person into the hospital, into the intensive care unit, say bye-bye sweet dreams, and hook them up with an IV and give a continuous drip of ketamine and keep their breathing going by a ventilator. They have tubes to get rid of their bodily fluids, and they're having an IV where they get sugar water throughout this time, and the person's actually kept in a coma for anywhere from half a day up to several days. And this is being forwarded now as a non-FDA approved treatment for chronic pain. Like I said, ketamine causes schizophrenia. It so reliably causes brain damage and mental derangement that it's actually routinely used by drug companies to create schizophrenia in laboratory rats. The idea being that once the animal is made to go crazy by ketamine, it's tested with various new psychiatric drugs to see what can treat the condition. And when ketamine was first brought on the market in the 1960s as an anesthetic agent, it gave such terrific bad mental responses to patients that they then were just using it in animals. But it just went into the lab to use as research to create an animal model of schizophrenia in order to test drugs. But now it's emerged again as an anesthetic agent, and with this ketamine coma as a pain reliever. Ketamine drugs really derange the brain in a lot of ways. It's been documented that ketamine disrupts the normal brain electrical waves, including the area of the brain that has to do with orderly sensing of the environment. And that's what makes people sense these hallucinations. Now, some of these brainwave changes have been shown to be permanent, which reflects brain damage. In fact, a study of rat brains showed that ketamine profoundly damages the ability of the brain to protect and repair itself from toxins that build up in the bloodstream from the process of everyday metabolism. So the brain is no longer able to protect itself. Ketamine also disables the antioxidant enzymes that are normally the constant protectors of brain cells. And ketamine was found to have this damaging effect in not just one, but many different areas of the brain. And it also deranges several brain messenger chemicals. Those are chemically known as neurotransmitters, but they're simply chemicals that help electrical impulses jump from one brain cell to the next. And it disorders the way the brain kind of reads these chemicals, the amount of the chemicals, how sensitive the nerve endings are to the brain messenger chemicals.
And this can happen with a one-time thing, or this?
It can happen with a one-time dose. Yeah.
Oh, my goodness.
Now, when we see how crazy making ketamine is, it kind of comes into perspective when you realize that the molecule is very much related to PCP, also called phencyclidine, or some people know it as angel dust. Now, this also started off as an anesthetic medication in the 60s, and like PCP, ketamine has become a popular street drug. In fact, these two drugs are so closely related that ketamine can give you a positive urine drug screen for PCP. In other words, it gets picked up on the drugs of abuse panel. In fact, the Drug Enforcement Administration's fact sheet describes ketamine as a, quote, dissociative drug. Now, that means that it gives the user a feeling of being disconnected from his or her surroundings. It causes delirium, amnesia, either mania or depression, and sometimes the person goes from mania to depression to mania again, back and forth very rapidly. And it also causes long-term memory problems, with the main thing that this shows up as: the person loses the ability to think rationally. So this is actually a drug that creates insanity. And this is also a drug, because of its amnesia effect, that is used as a date rape drug when it's used as a drug of abuse. Ketamine is an anesthetic, so it causes numbness. And since people on ketamine can't feel pain, they can't seriously injure themselves, or they can actually injure themselves without even being aware of it, because it anesthetizes you. It also makes the user lose control of their muscles. They have poor coordination or stiff muscles or slurred or blocked speech. It can cause a respiratory arrest. It can cause death. And mentally, it can give a person a false sense of invulnerability. This is the same thing we see with PCP. It's an exaggerated sense of their own strength, and it causes them to participate in violent behavior. Alternately, they might just sit there in a pre-coma state, not moving, with a blank stare, kind of what we used to call catatonia. So it's a drug of abuse, but it's also an anesthetic drug, and it's also being pushed for this ketamine coma for pain. Now, there is a thing that street users refer to called the K-hole, and this you get with higher doses. It causes a terrifying feeling of almost complete detachment from being able to sense the environment. So you're awake, you're alert, but you're not sensing the environment. It's been said that it's very similar to a bad trip on LSD. And it can go into a trance-like, out-of-body, near-death experience. And again, on the street, this is known as the K-hole. Now, with the idea of the ketamine coma is doctors are offering an intentional coma brought on by ketamine. And desperate patients end up getting talked into it, even though it has not been approved by the FDA to treat chronic pain. Its only approved use is in anesthesia in surgery. And with the ketamine coma, the patient's actually brought in the hospital. They're given a continuous IV drip of ketamine. They're laying unconscious for days on end. A respirator takes over their breathing. When the drug is stopped, the patient actually has to be physically restrained, pinned down with leather straps many times, because they're anticipating that there's going to be a psychotic coming out of the drug. They go into a psychotic behavior. The sad thing is that the chronic pain continues very rapidly. The ketamine receptors in the brain and also in the spinal cord get resistant to it. But unfortunately, those same receptors are the receptors that we use to sense abnormalities in our environment. So once somebody has had enough ketamine, they're not responsive to any pain drug, and they're hypersensitive to any bodily disorder. So it turns out that with these people who've had a lot of ketamine, everything is painful. Everything is perceived as pain, and that's how much these doses of ketamine so derange the nerve endings. But it can get worse than that. There was just a People magazine article a couple months ago reporting on this ketamine coma, and one person had a 5-day coma, and she needed months of therapy to relearn how to talk and walk and eat. She basically came out like a stroke victim. Another patient was in coma for 3 weeks and is permanently paralyzed from the neck down. Now, the bizarre thing about that story is she's quoted in People magazine as saying, "I would have it again, it helped my pain, life is wonderful," or something like that. A third patient that they featured in their article claims that the coma miraculously got rid of his pain. However, the article went on to say that he continues to need additional hits of ketamine injections on a regular basis. So we're essentially giving these people PCP or LSD-like drugs to kind of zone them out. And these patients were all described as being previously treated with high doses of pain medications, and that's why they went for this. But guess what? Most of them were still on narcotics after getting the ketamine, so it's no miracle cure. In fact, a 2009 study looked at 60 patients, half who got ketamine and half got placebo, and 12 weeks after the treatment there was absolutely no difference in their reports of pain. Now, the sad thing about this, like we see in so many other questionable therapies, is that these patient advocate groups are actually funded very heavily by drug companies that are actually trying to sell their treatments. And sure enough, there is a couple of chronic pain groups that look like they are patient advocate grassroots groups, but what we call these is AstroTurf. Because what's happening is Big Pharma is funding the group to the extent where they're actually directing everything about the group and funneling people over for ketamine coma studies and encouraging them to get this. If you go on some of these chronic pain websites, you'll actually see these videos and testimonials about how it changed people's life and all of that, and they're all completely funded and paid for by the companies that actually benefit from selling this ketamine. Ketamine was developed by a chemist named Janssen, Janssen, who formed Janssen Pharmaceuticals. It's very interesting that Janssen Pharmaceuticals it's now a sub-company of Orthonovum, but Janssen Pharmaceuticals is actually, they say in their website, dedicated entirely to mental health. That what they have is they have a lot of drugs that treat mental conditions. So here they are forwarding a drug that creates schizophrenia, and of course they have the treatment for that. It makes one wonder if they have any interest in generating lifelong patients for their products.
So are you saying the last study you just cited on the placebo and the ketamine group, that was pretty much a bogus result?
Yeah, there's just no result, but no better than placebo at 12 weeks, at the 12-week mark, no long-term effectiveness. And that's been the only placebo-controlled study that there is. Now, what ketamine does is it affects a lot of different neurotransmitters, brain messenger chemicals, but the primary one that affects is called NMDA. There are other drugs that affect this. Amantadine is an old-time drug that we used for flu 30 years ago, and it fell out of use because it had such a high incidence of causing psychosis. Of course, we know that all the antiviral remedies can cause psychosis. In fact, one of them, interferon, actually carries a homicide warning. But even Tamiflu, the anti-flu medication, now has suicide and psychotic behavior warnings, especially for children. But amantadine was one of these early anti-flu drugs that affects the NMDA receptors in the brain, just like ketamine. Amantadine is also used as a treatment for Parkinson's and Alzheimer's. Unfortunately, it has profound mental side effects. Dextromethorphan, and that's the ingredient in cough syrup that kids were dipping their marijuana cigarettes into, and now that's why cough syrups are now not available over the counter. You have to ask the pharmacist for them. You can still get them without prescription, but you have to ask the pharmacist. But that affects NMDA, and that's why it gives a trippy-like effect. Memantine is known as brand name Namenda. It's one of the newest Alzheimer treatments. Good old nitrous oxide, the gas that you get in dental surgery, affects NMDA. And that's why it's essential for dentists, if they're going to use that, to be absolutely quiet during that time, because anything that they say can actually act as a hypnotic command to the person that's under the nitrous gas, because it affects this NMDA. Phencyclidine, that's the PCP, and then this other drug is a new treatment for ALS, which is a degenerative neurologic disorder. And these all affect NMDA.
Now, what is NMDA again?
You're going to make me embarrass myself here.
I'll take that back.
Yeah, it's one of those brain chemicals.
Okay.
But it's interesting, if you can see here, memantine, brand name Namenda. Namenda is NMDA spelled out. Some clever marketing guy there aimed at that. Okay, we'll move on here to another bad idea in medicine, electroshock. Remember I talked about insulin shock? Well, electroshock actually predates that. Ugo Cerletti used it to shock pigs in the slaughterhouse back in the 1930s. And it was taken up by the psychiatrist, a German psychiatrist actually, and he developed the first ECT machine for use on humans in 1938. Now, the purpose of electroshock, its stated purpose is to cause grand mal seizures. And again, the idea being some vague idea of driving the demons out of the person's body. Now, we know from people who have epilepsy that seizures are not a good idea. In fact, the entire field of epilepsy treatment is to suppress the seizures, because we know that totally erratic, disordered brain waves are not good for you. They're not good for the brain waves. During the time when someone's having a seizure, it's been documented that there is cell death, there is lack of oxygen, there's a tremendously very quick buildup of all kinds of free radicals, which are very, very damaging to the delicate neurons. But in fact, the purpose of electroshock is to cause seizures. It may come as a surprise to some people that the machine that delivers the electroshocks is not approved by the FDA. In fact, it's in this classification called Class 3. And that means that there is insufficient evidence that general or special controls will provide reasonable assurance of safety and effectiveness. In other words, it has not ever been shown to be safe. It has never been shown to be effective. And it's one of these machines that was around before the FDA started to really classify medical devices. And that's one thing, you know that with Medical Accountability Network, I'm all about informed consent. How many patients who are signing a consent form for electroshock are told, by the way, the machine is not even approved, it hasn't even ever been shown to be safe or effective. This machine, by the way, is currently under review by the FDA to see if its classification should change. Shock, of course, is brain damaging. When we look at studies of people who have had traumatic brain injury, animals or humans, we find that there's neuron death, there's a tremendous release of damaging proteins, there's a proliferation of new cells, there's altered regulation of our chemical messengers, and there's also different ways that those chemicals actually express themselves. These are the changes we see after traumatic brain injury. These are the exact same changes that are seen after uncontrolled seizures, and after electroconvulsive therapy.
My goodness.
The exact same changes. So this is a brain-damaging procedure. Electroshock causes memory loss. It can cause loss of ability to remember things that happen, but it can also cause loss of ability to learn new things. So say after you get electroshock, you meet somebody new, and then you don't remember that you met them. But you also don't remember where you went to school. So it's got memory loss from the past, but also inability to retain new memories. Electroshock causes stroke, causes heart attack, causes bleeding into the brain, into the heart. They're even giving electroshock for women. It can cause loss of the fetus. It can cause rupture of the eye sockets. It can cause fatal heart abnormal rhythms. It can cause a shower of clots throughout the brain tissue, where a person has multiple areas of stroke. And electroshock causes death. In fact, the death statistics are pretty remarkable. This was a study done in 1993. I'm sorry for the old date. The problem is, ever since this study was done, nobody has done another study. But you could see here in the first year after electroshock, this was looking at elderly people who were depressed who got electroshock, okay? And the people who got shocked had survival rates of 73% at 1 year. Compare that to 96.4% surviving who were, age-matched elderly who were also depressed and were considered to have, an equivalent level of depression. By the second year, almost half of the people who got shocked were dead. In contrast, the depressed elderly who were treated conventionally, 90% of them were still alive. So this is a really brain-damaging procedure, and it causes death. Now, this is death from all causes. This isn't somebody who dies on the table during the procedure or a week afterward. Some of these people died from stroke, some from heart attacks, some from infection, some died from suicide. But these death rates are really, this is death from all causes.
Are these,
remarkable.
Yes. Are these, oh, well, I lost my thought now. Keep going.
It's shocking data. It's shocking
Yeah.
data. One famous shock victim is Nobel Prize-winning author Ernest Hemingway. He allowed himself to be talked into receiving 20 shock treatments at the Mayo Clinic. And the results really devastated him. He told a friend this. You can read it here. I mean, he was a writer. He was a creative artist. And shortly after this quote, he shot himself. He committed suicide.
And was he suffering from depression when he opted for this treatment?
Yeah. And went to what at the time was the best medical center in the world, the Mayo Clinic.
Are patients still being treated for depression with electroshock?
Yes, they are. Yes, they are. They are very much so. Electroshock ruins artists in particular, and here's just a partial list of some people who got electroshock and either met an untimely death, committed suicide anyway, or just plain couldn't pursue their art anymore. Towns Van Zandt, he's from right here in Texas. Cole Porter. Rocky Erickson, also from Texas.
Judy Garland from Wizard of Oz.
Yep.
Is that her?
Yeah, she's from Kansas, I guess.
Oh, she's actually from Kansas.
No, I'm joking.
Okay.
Electroshock also silences the unwanted. I've got a link down at the end where you can go watch a video documentary regarding what's going on in China with the use of electroshock to round up and incarcerate into psychiatric wards political dissidents, whistleblowers, government petitioners. Of course, Soviet Russia was the one who really specialized in this, but now China is taking this up. But it's happening in a lot of other countries. It has been documented to happen in the United States. There's actually a specialized unit in the United Kingdom called the Fixated Threat Assessment Center, and it's actually been granted the authority to incarcerate anyone who has given, quote, inappropriate or threatening communications to a member of government. And that center is basically people get whisked off to a psychiatric facility without any recourse to due process. That's a law on the books in the United Kingdom.
My goodness. That is actually happening?
Yes, yes. And again, the link, you can go look at the video of the documentary. Well, if that doesn't shock you enough, the latest and greatest thing these days is called deep brain stimulation. Now, this is really creepy. It's another bad idea in medicine. And like other misguided medical concepts, it's based on a little bit of science and a lot of theory. Now, theory's okay, you know, as long as it's workable, but this one, too, kills the patients. Deep brain stimulation has an unknown mechanism of action. We have no idea how, quote, works. I was talking to a neurologist a couple weeks ago who's done 300 of these procedures, and I said, so it's called deep brain stimulation, so I guess it must stimulate the brain. He goes, oh, no, it doesn't. In fact, it deadens the cells. In fact, the little electric shock that the wire into the brain that it's delivering actually creates a little bit of heat, and it's known to deaden the cells. I said, you mean it kills cells? And he goes, well, yes, that's one of its supposedly therapeutic effects. One theory is that this heat created by each tiny little electrical charge has an effect on brain messenger chemicals put out by the so-called wrongly firing brain cells. But when we can figure out what brain cells are wrongly firing, we're going to be gods. Another theory is that some little electrical shock pumped into the brain acts like little jump starts to overcome abnormal nerve impulses. But the bottom line is it is not known how it works.
What is deep brain stimulation used for?
Let me explain. It's used for Parkinson's, but it also just got special emergency compassionate approval by the FDA about 2.5 months ago to treat obsessive compulsive disorder. So here's what happens. A hole is bored into the skull. The person, by the way, is awake, but they're under a little bit of a light hypnotic drug like Versed. A hole is bored into the skull. A wire is poked through the normal brain tissue to get to the deep area that's affected in Parkinson's. Now, the patient's awake but somewhat sedated. The wire is dragged around the area, back and forth, and the doctor is looking, while he's doing this, at a tracing of the brain wave, and he's also listening. There's a little sonar, a little sound device. It's like click, 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 you know, little sounds. He's looking, he's hearing that, and he's dragging this wire back and forth, and he's looking at the brain waves. Meanwhile, he's asking the patient, okay, can you talk? Okay, move your right arm, move your left arm. Can you tap your fingers? You know? Sometimes they drag it into a certain area where the person starts to cry, or they start to hiccup, or they start to yawn, and they're like, oh, we don't want that area. They pull it back. And this is the scientific method by which they are determine where it's going to land, okay? So it's actually the normal scarring process of the brain, the healing process of the brain that causes scar tissue to form that implants this wire in place. And then they tunnel out the wire, and it goes underneath the skin to behind the ear. Then they put the patient under general anesthetic, and they put a combination battery pack programming chip under the skin of the chest, right under the collarbone, and then they attach it to that wire that's dangling down from the brain behind the ear. And this is all under the skin, right? Mm-hmm. And it takes about 2 weeks for that to heal, and then the patient comes back to the office, and they program the thing. They program it every couple weeks for about 6 months. Now, one of the problems with the surgery is stroke in surgery, up to a 2% incidence, which is higher than other surgeries. And sometimes this stroke is actually a bleeding stroke, that by jamming this wire through the brain tissue and dragging it back and forth, they actually disrupt essential vessels. Another risk of the wire is encephalitis. Now, the way the doctors who do this, what they say is, well, the wire can get infected. So any doctors listening, we know that inanimate objects don't get infected. They get colonized with bacteria. That what actually gets infected is the brain tissue. So because you have a foreign object in your brain, it's prone to attract bacteria and they colonize on the thing, and then it starts to invade the brain tissue and cause encephalitis. In which case the wire has to be pulled out. The person has to be treated with intravenous antibiotics for 6 weeks. And then hopefully, you know, you have to wait and see, well, how much brain damage was done by encephalitis. Now, I said that they get programmed. There are 29,000 possible programming combinations. Okay? So it's not a very scientific process to program it. It's actually, they call it tweaking, which doesn't sound very scientific. Now, what they do is they bring the person in the neurologist's office. He changes the programming, and then they keep you in the waiting room for about an hour and see how you do, and then send you on your way. But they confess that sometimes it's 1 to 2 weeks before they actually know the effects of the programming that they just did. But they send these people off on their way. Now, the idea with Parkinson's is they want to see changes in body control and tremor. And indeed, what this is FDA approved for is use in Parkinson's and also essential tremor, people that have just a tremor without the rest of what we know as Parkinson's. Now, a lot of people with Parkinson's don't have tremor. What they have is stiffness. They can't get their body to move at all. And some people have a tremor with that, others don't. In some people, the tremor is a major part of their Parkinson's. The important thing to know is that deep brain stimulation doesn't hardly at all affect the other symptoms of Parkinson's. Its primary use is for the tremor. It causes memory loss and emotional instability, terrific mood swings. Can cause people to weep uncontrollably, laugh without feeling happy, yawn repeatedly, feel fearful or anxious. There was a study that was recently reported in the Journal of the AMA that described DBS patients suddenly dropping into apparent deep sleep, like boom, like they're gone, like catalepsy. The family can report that the patient's slipping into low moods or having severe memory problems, or quickly being unable to make everyday decisions. Now, this is executive function. Studies have shown that DBS patients, compared to Parkinson patients who are at the same stage of their disease but just get the regular medical treatment, the DBS patients have worse executive function, more depression, they have more stiffness, they have more balance problems, they have increased falls, and because of increased falls, they have increased fractures. Now, what they have is less tremor, but it comes at the cost of all this other stuff, and they have worse quality of life, independent of improved movement. So the worst, balance and falls is one of the worst things, because obviously this makes these patients less independent, and they become dependent. They now have to have a caretaker. There's definitely more hip fractures. Another problem is in Parkinson's, sometimes there's an inability to start a stream of speech, or they have hesitant speech. They can think of the words, but they can't actually get their mouth to do the movement to make the word. And that speech hesitancy is sometimes quite a bit worse after deep brain stimulation. It's one of the very common adverse effects. So let's say this patient had a tremor and it got partially or completely treated by the wire, but now he can't talk. There was an interesting study done at the Hines VA up in the Chicago area just in January of this year, looking at Parkinson's patients becoming apathetic. And there's actually, psychiatrists have what's called an apathy scale. And they reported that apathy scores worsened by 50% after 12 months of having this wire compared to the pre-wire apathy score.
Where do you get all this research from?
You know, you type in deep brain stimulation side effects. It's all in the National Library of Medicine. This is in everyday medical journals. I barely had to scratch the surface to get this. Now, where does this apathy lead to? Suicide. A fantastically increased incidence of suicide, 1,000%, according to one study. However, the National Institute of Health said that the DBS patients have anywhere from 13 to 37 times the suicide rate. So that is 1,300 to 3,700 times the suicide rate compared to elderly people without Parkinson's. Now, the National Institute of Health study looked at elderly people without Parkinson's, whereas this 1,000% increased suicide rate is compared to Parkinson patients getting normal medical treatment. You think that's bad? Now, that's bad enough, right? But what the average everyday person doesn't realize is for every one of these completed suicides, there's another suicide attempt. There's a 2,000% increase in attempted suicides.
Moira, please explain to me if the National Institutes of Health, even the National Institutes of Health say this is bad for you, why is it still being used? I don't understand that.
Why did it get compassionate, quote, compassionate emergency approval for obsessive compulsive disorder? I tell you, it makes a lot of money for hospitals. The other thing with deep brain stimulation is people become lifelong psychiatric patients. Now, these deep brain stimulation centers have what they call multidisciplinary treatment teams. This is a code word for psychiatrists. And what they do is they put you through an extensive neuropsychiatric evaluation before you even get the surgery, because they are clued into this increased suicides, right? And they'll even put you on, if they detect any depression, they'll put you on psychiatric drugs preoperatively. But let's say you weren't depressed preoperatively, you're basically always being evaluated by a psychiatrist for the rest of your life. And they start adding psychiatric drugs. So obviously psychiatric drugs affect the brain chemicals. What we know about Parkinson's is they already have deranged brain chemicals. But here's the real tragedy of it. In some people, this deep brain stimulation reduces their tremor. In other people, it actually helps them get off their Parkinson medications. On the order of 6% of people actually get off all of their Parkinson meds. The remaining 94% are still on their Parkinson medications. But what they offer with this deep brain stimulation is, look, maybe you don't have tremor, but we'd still like to offer it to you for your Parkinson's because we think we can reduce your Parkinson medications. And they offer them this hope of reducing their Parkinson medications. So anybody who's had Parkinson's for more than a couple of years really wants to reduce their medications because the medications themselves cause severe movement disorders. It's another disorder called dyskinesia. And it's herky-jerky movements independent from the Parkinson's, you see. So the Parkinson patients really want to reduce their medications. And this is offered to them as something that will reduce their meds. But the depression that the Parkinson patients get who have DBS, guess what? It doesn't respond to antidepressant treatments in 73% of cases. The only thing that helps it is to resume their anti-Parkinson meds at the dose that they originally were before they got the wire. So in other words, the whole reason that they're offering this gets dashed because they have to give the medication back anyway because it's the only thing that will treat the depression that emerges in the vast majority of cases. But now, you know, let's say some person, you know, they do respond to antidepressants. Well, now you've traded the mental side effects of psychiatric drugs. You've just done a switch. Instead of having the mental side effects of the wire, now you've got mental side effects of psych drugs. In other words, it's just like a house of mirrors, and these people become lifelong psychiatric patients. They are much less independent. I mean, when you see these kind of suicide rates, these people need to be on 24/7 suicide watch the rest of their lives. You know, that's a huge burden on the family, not to mention what it does to the patient. And like I said, studies that have looked at the quality of life and independence, poor quality of life, independent of any benefit they actually got from the wire. Let's say the wire did improve their tremor. Let's say the wire did, reduce how much medications they needed. It still does not result in scores of improved quality of life. So it's independent of improved movement from the wire. The real tragedy is there's an utter lack of informed consent. What most patients are given is a video from the device manufacturer, from Medtronic. And it's actually a video called Potential Side Effects and Risks. I mean, that's a section of the video, right? And all they say was, well, it can cause a tingling sensation. It can cause, in some people, okay, it can cause a little worsening of symptoms. This is all in small print after the video has shown you all these miracle cases, right? It can cause, maybe some speech problems. It can cause some dizziness or lightheadedness. Well, in a Parkinson patient, that's disequilibrium. That's where the falls come from. And then it just says, oh, your doctor will tell you more about side effects. And the good news is that these side effects, can be managed by adjusting the settings and getting medication. And then it says, of course, implanting the wire carries the same risks with any other brain surgery, and that could be hemorrhage and infection and, pain. And they don't mention suicide.
They don't. Are they supposed to?
They do not, they don't mention, well, informed consent. I mean, it's not to the device manufacturer to mention suicide. It's obviously up to the doctor. Now, if you go on to websites where they're advertising this, by the way, every little hospital these days is offering deep brain stimulation. But if you look at some of the bigger ones, Johns Hopkins, Scott and White here in my neighborhood, Mayo Clinic up in Minnesota, Georgetown University in Washington, Stanford Clinics out in California, they have big websites that are directed toward consumers to try to sell them this deep brain stimulation. But if you actually go look at the websites, they sorry, here I'm looking at my slide here. They really paint a picture. It looks like you're just going in for, excuse me, a boob job, and your life is going to be wonderful afterward, right? The Mayo site says, quote, side effects are mild and reversible. Now, since when is suicide reversible? The Stanford site says, well, the risks are brain hemorrhage, leakage of spinal fluid, infection, seizure, stroke, confusion or attention problems, speech difficulty. No mention of suicide. Scott and White is the most extensive one that I was able to find on the internet. And they do say that they have one little mention of psychiatric and behavioral issues. Johns Hopkins puts it at the very end of their disclaimer. They say, lastly, a cognitive evaluation is important to help you to see if you're a good candidate to participate in the implantation of the stimulator, as well as in the post-op process of programming the stimulator. Now, would anybody reading that get the idea that I'm going to be psycho after this?
No.
Georgetown University shows you the Medtronic video, and the narrator from Medtronic says the side effects are balanced, speech problems, and mild, and the effects are mild and reversible and are accepted by patients. But in really tiny small print, it says you can get jolting and shocking sensations, you can get hemorrhage, tissue damage, weakness, and headache. No mention of suicide. And doctors rely on these videos, and that sort of takes the place for informed consent. And they also see nothing wrong with just creating lifelong psychiatric patients. The real sad thing is that both electroshock for mental conditions and deep brain stimulation for Parkinson's or for mental conditions really preys on desperate patients. And this is where the lack of informed consent is especially heinous because the reality is these are brutal procedures that kill people, and they are absolutely just victimizing desperate patients. and not telling them this information. And I like to remind people about Frankenstein. A lot of people hear the word Frankenstein and they think of the monster. But the Frankenstein was the name of the doctor. And the monster, if you remember the book and the movie, he was the emotionally tortured victim who could not even control himself. And in both of these cases, electroshock and DBS, we have to remember who the victim is here and who's the monster. Dr. Frankenstein, he's the one who was named Frankenstein. And this is where mental health watchdog groups really come into play. I would urge anybody interested in this to look at the website of the Citizens Commission on Human Rights International, and you can find a lot more information how electroshock is actually being used politically, documentaries on that, and also on what's happening with the FDA trying to get the electroshock machine brought up to a more acceptable status, and what's happening with that, but also other brutal therapies in the name of health. There's a lot of other websites where you can learn more. ECT.org is excellent. Citecrime.org, mindfreedom.org, endofshock.com is actually a Texas website. I urge anybody listening to this, if you yourself or you know somebody who has had an adverse effect from electroshock, now would be the time to make a report to MedWatch, which is the online FDA safety reporting system. Because of how the machine is now being looked at for changing its classification. Also, any DBS patients who weren't informed of some of these potential effects, or if you just have questions about it, I'm actually myself trying to collect stories of people who know someone who had DBS or is getting DBS or got DBS, and what their experiences are and what they were and were not told. There's actually legislative movements underway to require hospitals to report their suicide rates, because all too often what has been reported is, well, the person committed suicide, that was from depression, and they don't attribute it to the wire. But there was a study that came out in the journal Brain in October 2008 that looked at over 5,000 patients at multiple centers around the world. And these are the ones, they found this 1,000% increase in the suicide rate and 2,000% increase in suicide attempts, and they attribute it directly to the wire. Just fantastically, increased rates. So I definitely want to put the word out there that anybody can send me an email at this email address here, Dr. Dolan at medicalaccountability.net, and I'm actually taking on the DBS crusades more than anything because they tried to put one in my mother and didn't tell her anything about it.
Oh, you're kidding.
You can read about these bad ideas in medicine. It's a regular feature of smartmedinfo.com, and we'll be adding to it as crazy doctors continue to promote brutal and ridiculous therapies. And knowledge is power, as you said at the beginning, David. Yeah. And there's a lot out there that your doctor may not know or may not be telling you, and does not feel that it's his job to let you know or even for him to find out.
Right.
Well, that should have generated some questions from our audience.
I'm sure. Hey, folks, if you have any questions, just type in the chat box to your right, and we'll be asking the questions as you type them in. Well, Moira, you were right. The leech thing was the best part. That was the best.
It was the best news.
That was the best news. Yeah.
It was the least bad idea in medicine.
So, what other ideas do you have for us in the future?
Well, when you are giving a type of insulin that increases the cancer rate to diabetics, that's not a real good idea. When you're lowering the cholesterol so low that it strips cholesterol from the brain neurons and you're increasing Alzheimer's, that's a pretty bad idea.
Right.
I mean, promoting mass flu shots for for a preparation that's only been tested for about 3 weeks, that's a really bad idea.
Really? Oh, no kidding.
You know, promoting a flu remedy that costs $110 and only reduces the symptoms of flu by about 1.3 days, and that only in about 30% of people, and only if they took it in the first 24 to 48 hours of symptoms. That's a bad idea.
Boy, I always thought that, well, if the NIH comes up with something, just going back to your lecture on the DBS, if the NIH says this is bad, I thought that was enough for any kind of treatment to be pulled from the market.
Well, just like the ketamine coma, it's not even FDA approved. This deep brain stimulation is actually FDA approved. The ketamine coma is not, but as you know, doctors, it's not illegal for doctors to practice medicine in ways that, and use machines and use devices and implant things that it's not FDA approved. But what is illegal is for them not to give full informed consent.
Mm-hmm.
You know, that when a person is consenting, they're consenting with the idea that they got full information, and they're given the impression that they got full information. But actually they didn't. I sat in the office of my mother's neurologist for an hour and a half, giving him every opportunity to tell me some of the stuff I had just read in his own medical literature, neurology. And he repeatedly denied that there was any of these effects. Of course, he changed his tune when I started pulling out some of the articles from my briefcase.
Okay, well, we have a question. DBS treatment is so self-defeating and totally pointless other than adding more miseries to the poor patients. I can see that with the healthcare reform, more of us will be forced to receive this treatment as a way to reduce health costs. What's your comment on that?
Well, indeed, there was one article that I read. It was actually it was an online newspaper where they were talking about what are the ethical issues regarding deep brain stimulation. And there was a woman who was going crazy with the deep brain stimulation, but her movements were so much better that it was easier for her caretakers to bathe her and get her dressed and feed her. Mm-hmm. And so the caretakers wanted her to continue to have that wire in, whereas she was getting so psycho from it that, on the other hand, they were saying, well, should it come out so that we can preserve her personality, her mind, her ability to think? And they called it an ethical dilemma. Now, in my book, to have an ethical dilemma about that, I mean, that's ethically constipated. Okay, I don't want to say any bad words on the air here, but, it's like, okay, just like Ernest Hemingway said about electric shock, okay, the treatment worked, but you lost the patient. Right. And so they actually were, putting this question up to an ethical board at some medical center of, gee, what should we do? Should we give the patient back to herself? But she's so much easier to take care of now with the wiring.
Oh.
I mean, I was just so outraged I couldn't even respond to the article. It's like, anyway.
Yeah,
I mean, it just shows you how morally bankrupt medicine has become.
Mm-hmm. Mm-hmm.
And it can only happen if, like you said at the beginning, if people have false information or no information. And that is why this all hinges on informed consent. If people were actually told the death rates with electroshock, how many people would do that? Memory was another thing. There was statistics collected by the Department of Health in California for a short time that showed that 99% of electroshock recipients have significant memory loss, whereas the brochure at that time from the American Psychiatric Association said that it only happens in 1 in 200. And when really pressed to find out, well, where did you get that statistic, they admitted, oh, well, we made it up. whereas the Department of Health actually had records that showed 99% increase. Another interesting thing with electroshock and death, here in Texas, a law was passed that every place doing electroshock had to report deaths that occurred within a certain period after electroshock. And just with that law passing, the incidence of hospitals giving electroshock went down by 33%. When they were required to report deaths. Isn't that interesting? You know, in other words, this is going on, and it's going on a lot, and they're not held accountable. And particularly for deep brain stimulation, we now actually have a precedent with electroshock. There's a case I'm familiar with up in New York where a psychiatric victim is getting court-ordered forced electroshock. And this deep brain stimulation is even scarier. And can you imagine people having court-ordered deep brain stimulation for their obsessive-compulsive disorder?
Oh, I can't imagine that. I can't imagine that.
And electroshock is not even an FDA-approved, the machine, the device isn't even FDA-approved, and there's court orders for it. You know, DBS is FDA-approved.
All right. Someone says, this is a wonderful presentation. I work in psychiatry as a nurse. This is profound in capitals. Our doctor has done ECTs on our teens.
Has done ECTs on who?
Teens, teenagers.
The teens, yeah. Yeah. There's only a few states in the nation where ECT is forbidden below the age of 16. And luckily, Texas is one of those states. I believe Tennessee is one of those states. But you can shock a 3-year-old in New Jersey.
Oh, my goodness. That just messes the child up for life.
Yeah.
Oh, boy. Okay. This is depressing.
I'm sorry. Sometimes it takes a confrontive evil. I want to go back to the slide that had the resources on it because I want people to be able to get some of these, go to some of these websites. Of course, they're all prefaced by, you know, HTTP, www, all of that.
Okay. Is DBS commonly used in other countries as well?
Yes. Yes, it's used on, in fact, a study I quoted from the journal Brain, October 2008, of over 5,000 people where they found that tremendously increased suicide rates. That was the study that was done at centers all over. It's used in France. It's used in some Eastern Bloc countries. It's used in South America. It's Canada, United States.
Mm-hmm. Okay. Are there psychosis-inducing chemicals in cortisones or asthma inhalers like Advair? And I know you did a talk on psychoactive drugs and drug safety.
Yeah, Advair hasn't been implicated. Singulair is the one that was implicated as possibly having mental effects, and there was an FDA alert about it. Now, this isn't quite a warning, it's just an alert. And then there was an additional study done. It was smallish, and it was, I believe the drug company helped to finance it, and it did not pan out that they could prove that there was an increased incidence of mental problems with using Singulair. However, individuals continue to make reports to MedWatch that they do feel that they have some mental problems from Singulair. I'm not familiar with that with Advair, but sometimes these asthma drugs can cause what's called a sympathetic reaction where the heart rate goes up. Mm-hmm. And that alone can kind of get a person into somewhat of an anxiety state. Mm-hmm. Other of the asthma inhalers are actually steroids, and steroids we know can cause roid rage and other things. Right. And although most people who use inhalers aren't on very high doses and only a small percent's absorbed, for people who, you know, do use quite a bit of it and are also occasionally having to take oral medication, steroids on top of it, it can actually add up. And some people, it can make you a little wacky.
Right, right. Okay, my son heard of the electroshock treatment and wanted to get it done because he has ASD, and he thought it would stop his anger.
Okay, well, she needs to look at our webinar on autism spectrum disorder. And autism spectrum disorder, as I explained at that time, is, at the fringe of what's even considered mental disorder. In other words, it's what used to just be called, shy, backward, a little odd, having peculiar interests or whatever. But it did not used to be called a mental disorder. Now it has a label, it has a billing code in the Diagnostic and Statistical Manual, and it has drugs that are being advertised to be used for it. And there has been to date no brain biochemical or anatomical disorder or any genetic abnormality proven for ASD, autism spectrum disorder. So I would not undertake a physiologic, biochemical, or anatomic physical treatment for that.
Well, the topic that the webinar Dr. Dolan just mentioned is called Autism, What is it? And it's on our website. She also did a wonderful presentation on psychoactive drugs and public safety. That's also recorded and it's on our website as well. All right, Kay says, this really scares me to express conditions or depression issues to my doctor. Aren't pharmacists also liable to warn about ketamines, etc., when dispensing drugs?
Well, psychiatrist doesn't get involved with ECT or the deep brain stimulation, but yes, they get involved with ketamine, but that's usually an inpatient in the hospital procedure. And it's something the doctor's right there injecting. The pharmacists more get into the act when they're actually handing over a bottle of pills to you at the counter at the Walgreens. And they do have an obligation. Their obligation differs state to state, but the reality of the business of pharmacy leaves absolutely no opportunity for true informed consent. The other thing is that pharmacies are dependent on doctors to refer patients to use their pharmacy. And if the pharmacist starts giving information that the doctor himself hasn't given or conflicts what the doctor gave or, somehow reflects poorly on the doctor's failure to give full informed consent, then that can damage the referral base for the pharmacy.
Right.
So for many, many reasons, pharmacists, unfortunately, are not routinely giving informed consent.
All right, someone says, thank you, Dr. Dolan, for delivering this ethical shock therapy so that we can avoid future medical pitfalls in our choice of treatment. Thanks, Dr. David, for having experts like Dr. Dolan and many others to educate us. Hats off to you both. Well, thank you.
Well, thank you very much. Tell your friends, and like Dr. David said, there's a wealth of existing past presentations, available through Building Strength webinars, and I urge you to look into those.
Oh, thank you, Dr. Dolan. Sure, we need to have more people like Dr. Dolan put in plugs for us. Okay, any thoughts on cancer therapies versus chemotherapy and its dangers? Oh, okay, well, Dr. Dolan has also done a presentation on therapies, cancer therapies as well.
Yeah, I can't really go into that now. I mean, obviously, any drug, you have to weigh the benefits versus the risks, and what I always tell patients is follow the statistics. Be objective. Follow the statistics. You don't want your doctor, you don't want to say, well, should I really use this doctor, and have them go, well, if you were my mother or my sister, or if you were in my family, I'd want you to have it. That's an emotional decision. What you want is hardcore statistics. So with any kind of treatment, I say, follow the statistics. Ask your doctor for the statistics.
Well, they're going to give it to you.
Find another doctor then.
Yeah, well, that's going to be tough as well. But anyway, it sounds like the FDA is doing a bad job of regulating these devices like the ECT machine and the DBS system. Why isn't the FDA stopping these things?
Well, didn't I give a talk on that as well, David, when I gave my conflict of interest section on my informed consent? That's actually a whole other talk as to, the government entities that we think are protecting us are, for instance, in the case of the FDA, oftentimes little more than a a rubber stamp approval machine for the drug device and drug companies. We find that in the FDA in particular, their advisory committees are often stacked with people who have gross financial conflicts of interest. Notwithstanding the rules and regulations that forbid that, waivers are routinely granted. For instance, if I get up and testify regarding electroshock, and I'm just reading the scientific literature, right? I could just say, look, this is what the literature shows, this many deaths, this many memory problems. But if I get up and testify, I'm routinely asked, well, Dr. Dolan, how many times have you electroshocked somebody? Well, never. You see, what they do is they say, well, we have to get the experts in this to testify on it. Well, the experts are making money on it, either directly from their patients or directly or indirectly from the device manufacturer. Or like Janssen Pharmaceuticals, funding the pain website that promotes the use of ketamine for chronic pain. The entire rest of their pharmacopoeia is drugs that treat the hallucinations and psychosis that ketamine causes. And yet that's where, most of the doctors who are doing the ketamine coma are in the pay one way or another of Janssen.
Right. Someone says this is really scary. Someone else says, I am now well informed and I thank you greatly. It seems like almost everybody else is in a state of shock, so we're not getting too many other questions.
We should have called it shocking medicine. Well, here's the thing. I know that most of the people listening are not going to be candidates for deep brain stimulation or electroshock or leeches, okay?
Thank God.
But what I hope they get from this is a way to think about informed consent and a way to think about how to be a smart consumer when you go to a doctor and you're offered a drug for restless legs or a drug to help you sleep or a drug to help you wake up or a drug to soothe your tummy because you ate something a little spicy or whatever you're being offered. I hope that this talk gives you a way to think critically as an informed consumer. At some point or another, most people are going to need some kind of treatment or other for something, even if it's just athlete's foot. But guess what? One of the drugs that they give for athlete's foot, athlete's foot, it itches, it's bad, it stinks, okay, fine. But one of the drugs actually causes liver failure. Now it's like you've really got to look at the risk versus the benefit ratio.
Right.
And you've got to be told about these things in advance so that when you consent to getting a drug, that you know what you're getting into, and that goes for any treatment.
Now, on your website, do you have a list of drugs and their side effects and what you need to know about them?
Yes, what we have is we have drug information in totally lay language, and we distinguish ourselves because we accept absolutely no funding from anyone who has anything to sell, whether they're selling a deep brain wire or a cholesterol drug or flaxseed oil. We do not accept any advertising, and we ourselves, the writers and editors for SmartMed Info, are not in the pay of anybody who has anything to gain. So we just tell it like it is. We give the lowdown on specific topics, whether it's cholesterol or vaccines or autism, and we give the actual drug information in lay language. We have near about 150 drugs right now, and our library is constantly growing. So we definitely urge you to check it out. We also have short videos on everything from the osteoporosis drugs to, let's see, I think we've got one on bipolar, and we've got one on statin drugs. So anyway, there's a lot to check out there, smartmedinfo.com.
Well, thank God for people like you, Moira. It's a tremendous resource.
Well, I hope that whoever listened to this, if they feel like somebody else needs this, to remember that you can get the past webinars on. Is it still on MP3 format?
Well, it's actually video.
Video, okay.
Video, both, okay. Both of them, yeah.
Good.
Yeah.
And also we do provide handouts. I'll make sure to have all the references that I referred to in case anybody wants to do more of their own research on this.
Great stuff. Great stuff.
But like I said, I really want people to go ahead and feel free to email me and contact me if they have anybody they know that's had DBS. I'm really myself taking this on as my own little crusade. I'm going to join the legislative efforts that are trying to get hospitals to be mandated to actually track and report the suicide rates. That's something that was never done with the electroshock machines, and we want to get this one, early on and not be dealing with it, 70 years later.
Right, right. So if you know other people as well, even if you don't know anybody, just get the word out, folks. Get the word out.
Exactly.
Okay, well, this sort of wraps things up for tonight. Moira, again, I want to say thank you for taking the time to prepare this. I know you're going to have some other shocking revelations for us, and so we'll schedule them as soon as they're ready.
Okay, great. Well, I wish I could end on a high note, but basically we're just practicing, and you need to be a smart consumer.
Well said. All right, folks. Good night, and see you on Monday for Ken Talbot's presentation on spirulina and the immune system pioneers. Good night.
Good night.